Thank you, Premier. So, New South Wales recorded 177 locally acquired cases in the 24 hours to 8 p.m. last night. It's so pleasing to see those high testing levels of 94,532 tests, and I want to thank the hardworking pathology companies, the community, and also our collectors for doing that amazing work. Sadly, we've had a death overnight in a woman in her 90s who died yesterday at Liverpool Hospital. It was not related to the Liverpool Hospital outbreak that we had discussed previously, but this is the 11th COVID death related to the current outbreak. She was not vaccinated and tested positive on the July 24th. There are currently 165 COVID cases admitted to hospital, 56 people in intensive care, and 22 of whom require ventilation. As the Premier has said, we are confronting a situation where the two key drivers of transmission remain connections between household transmission and also workplaces. Now, clearly a number of workplaces need to continue to work, and those workplaces can generate exposures, and we have clusters of cases there which then take it back to those households, triggering another cycle. But on a positive note, the things that we know work. We know lockdowns work, and we just have to hold our course. And we also know that we have other tools that we haven't had before, and those other tools are vaccination. And can I please just stress again that it is important that we use vaccine as a way to assist us, and it will be our future in terms of coming to terms with COVID, and at a time when we will have to accept that we have community transmission. So we need to get those vaccine coverage levels up. We need to protect our most vulnerable, which is our elderly, for which COVID is a very severe disease, but we need to up our COVID vaccine coverage across all age groups. Can I just indicate an initiative that the local health district has put in place at Prairiewood Youth and Community Centre, 194 to 222 Restwell Road, Prairiewood. There is a clinic there, an AstraZeneca clinic, which is open from 8 till 4:30 p.m. And just a big shout out to the community of Fairfield that community, that centre, is going to be open for walk-ins. So you don't need a booking or an appointment. That centre will be open and available to provide access to complement the role of general practice, complement the other health services in the area, and complement the pharmacies. So my key message is we need to hold the course. We all have a part to play in getting through this, and that the path forward is a combination of remaining at home and staying at home. Every time you leave the house, ensuring that you believe that you're coming into contact with someone with COVID. So do not interact with others. Do not have conversations when you're meeting up with people in the supermarket that you know. This is a time, if we all act diligently to make sure that we don't have any contact with anyone outside our household, it will help us get on top of this. Also, as we've seen, the greatest risk is the household. So again, I know that you do want to take the opportunity to visit other people, but please do not. This is too critical to protect you and your loved ones to stay at home. And my other key message is get vaccinated. And also, whenever you have symptoms, get tested. We're still seeing people that have been in workplaces for a number of days whilst infectious. And that poses a risk to that workplace, and also will then lead to the introduction into another set of households and trigger further transmission. So thank you to the communities. Also, can I express my gratitude to the communities of southwestern Sydney? I grew up in Punchbowl and had the privilege of working in southwestern Sydney, based at Liverpool, Bankstown initially, and Lidcombe, and then moving to Liverpool. And I had the privilege of working with the communities of Western and Southwestern Sydney. They are such strong, resilient communities, and I want to acknowledge the role that community leaders and others in those communities have in getting the messages out and supporting the communities at this difficult time. So my heart goes out to those communities, but these steps and actions are required to protect you and your loved ones And again, I urge you to take up the opportunities for vaccination as soon as possible, recognising that for even the protection from the first dose, we need 2 to 3 weeks. And so there is an urgency that you go out and avail yourself of vaccine. Thank you.